My name is Ashlynn Nieve. I'm 18 years old and I had chronic pancreatitis for 8 years. I was diagnosed in August of 2013, but 2 years before that I kept going back and forth to urgent care, and they always told me that I had a weak spot in my stomach, constipation, or the flu. But then one time I went to urgent care and my dad and grandpa both had pancreatitis, so they transferred me to Luso Packard. And at the hospital, they decided to give me genetic testing, and then my results came back as SPINK1 genetic chronic pancreatitis gene mutation, and that's when I was diagnosed. When I was 10 years old in 6th grade, I was going into the hospital once a year, and then it slowly turned into once every 6 months. But I was still able to fight through the pain and go to school. But then eventually it started to get really bad, and my hospitalizations turned into once every 2 to 3 months, and that's when I started to miss a lot of school. But since pancreatitis is so rare, when you tell the teachers that I told teachers that I had chronic pancreatitis, and at first they just were like, oh, you just have a stomach ache, you're fine, you can go back to class. But then it slowly became like a every couple months thing, and they didn't believe me, so I had to get my doctors involved. And when I did that, they thought I was writing my letters of why I was sick and not the hospital. So it was really hard because it was like they kind of put you down as like, oh, you're not sick, you're just missing school for fun. I put my mind to, I'm going to graduate, I'm going to do great in school, I'm going to have a great future. And I fought through the pain, and I ended up graduating high school with a 4.0, which kind of surprised me because teachers always doubted me. Having chronic pancreatitis put a really big dent in my life because I was a very active kid. I was very passionate about basketball, so it was really devastating because I had to go to the team and I was like, I have to quit. It was just really hard because they're like a second family. My advice to other kiddos out there with chronic pancreatitis or any form of pancreatitis, that to never let teachers tell you you can't do something because you're sick. As long as you put your mind to something, you could do it. You have a future. You could do anything any other person can do, but you are struggling 10 times harder, which makes it 10 times better to say, oh, I did this and I had pancreatitis. And to never let chronic pancreatitis become your identity. Still have fun even though it hurts. As long as you put your mind to something, you could do it. So just always keep that in the back of your head and stay positive. And always tell yourself, even during hard times or hard situations or whatever you face in life, just say you could do it.